The difference between EMDR and traditional psychotherapy is that it often works faster and there's a whole lot less talking. And that's one of the reasons why people like it, is because they don't have to go into the details of things that have happened to them in their life, and especially when those things were very disturbing. EMDR is used for all sorts of issues that people come into therapy with, but it is best known for treating trauma and PTSD. So what is EMDR? It stands for eye movement, desensitization, and reprocessing, but that probably doesn't really explain much. So I'll walk you through a little bit of what you would expect if you come to see me and we use this type of therapy. So the first few sessions look the same. It's a lot of history, getting to know you, understanding your life from the point you were born to where you're at today. We move into learning how to be calm, which might sound pretty simple, but when you have a lot of anxiety and things going on in your brain all of the time, it's actually a pretty difficult task. So luckily, I have a lot of ways to help my clients to learn how to be calm and be in a still place. Then we move into the EMDR part of therapy, which is targeting specific events that have happened in your life. We target the feelings, the negative beliefs that you have about yourself, and the body sensations all associated with the event. And I use eye movements or tapping, and that's the part that seems weird to people. It's not hypnosis, even though the developer has a background in hypnosis. But anyways, what happens is your brain is like daydreaming in a way, or just being mindful. So part of you is in the past processing the experience, and another part is in the present. And honestly, that's what the point of the eye movements and the tapping are, is to keep you in the present so you're not re-traumatized and you're not reliving the event. To explain a little bit further about what I mean by eye movements is we set up a scenario. You're in a memory and you have a lot of feelings going on. And what happens is I tell you to just let your brain go and do whatever it needs to do while simultaneously following my fingers with your eyes. So I'll be going back and forth and your head will be still, but you'll just be watching my fingers with your eyes. I always start with the eye movements. If for some reason that doesn't work for you or it's uncomfortable, we move to tapping. And that usually works for people if the eye movements aren't your thing. And that's okay. So we do this for a session, a few sessions. It depends on how long it takes until the memory is completely healed. What do you mean completely healed? Some people worry that I'm going to take the memory out of their brain, but trust me, I do not have that ability. What happens is you still have the memory, but when you think about it, it is a lot less disturbing, or basically not disturbing at all. So if something really horrible happened in your life, and every time you think of that thing, sometimes you notice body responses, feelings come up, and it has obviously gotten in the way of your life if you're looking into this type of therapy. So therefore, you'll be able to recall an event and not have all of those feelings come up. And it'll be just like any other event, like you brushed your teeth this morning. It doesn't give an emotional charge when you think of it. So honestly, I still find this therapy to amaze me. My clients find it amazing, and I know it's talked up a lot, and it's not magic, but when it's used well and you're ready for it and it moves through, it sometimes feels like that. So what are some things that people use EMDR for? So like I was saying, it's often used for trauma, so near-death experiences, sexual assault experiences, death of a loved one, watching someone die, pretty much all of the worst things that you could imagine happening in your life and still living through them, EMDR can help you with. It's also used for other events such as bullying, issues in the home growing up. I do a lot with childhood trauma, and it doesn't necessarily have to be physical or sexual abuse. It can be emotional abuse or neglect, and it's used in many different ways. There is also another protocol that I use called the Feeling State Addiction Protocol that's used for addictions. And sometimes I'll bring that in a lot with the people I use for emotional eating and things like that. So a reprocessing session usually starts with what's called the assessment. So that's picking out the memory and getting the negative feelings, body sensations, and beliefs associated with it. When you're there in the disturbance is when I start the eye movements. The eye movements will last for about 15 to 30 seconds until I ask, what are you getting now? Because like I said, it's kind of like daydreaming or just being mindful. You're just watching your brain. And so that changes from time to time. So you just give me a little snippet of what's going on for you. And like I said earlier, you don't have to tell me everything that you were thinking about. If you want to, you can, but you don't have to for my benefit. And we keep doing that, and we go back to the eye movements, and 15, 30 seconds later, I ask you, what are you getting now? And we keep doing that until the memory is clear. And like I said earlier, clear means no disturbance. There's a few more steps after that, but they're pretty short, and it has to do with instilling the positive feelings that you have after the fact. So lucky for you, my trainer is very thorough, and she does what's called a white glove test. The idea is that when you walk out of my door, when you have completed therapy, that these problems will not come back to you. So the gains that you get from therapy, from EMDR therapy, will last the rest of your life. You won't have to keep coming back. If you do come back, it's likely due to other stuff that has popped up or new events that happen. And honestly, bad things are happening all the time, unfortunately. So sometimes people need to come in and clean that up. EMDR therapy can get pretty intense. So I walk you through a script before we start that says if you need to stop, to let me know and we can stop. I can usually tell when things are getting intense, but if you can handle it, we can keep going. And it's not bad if you need to stop. And like I said, we do a lot of prep work to make sure that you feel really ready to go through these events in your life. So it can get pretty intense, but I won't go there unless if you have the skills to go there. The amount of sessions that we have before we start the reprocessing vary greatly from person to person. It could be just 2 or 3 sessions, or it could literally be a year of treatment. It really depends. I also specialize in treating dissociation. If you have significant levels of dissociation, we cannot reprocess until we have some integration. What happens here is that not all parts are receiving the treatment if you're highly dissociated. So first, we have to treat the dissociation at least to a level so that all the parts are getting the treatment. Otherwise, you're just wasting your time and money. So if you've been receiving therapy from a therapist and you don't want to change therapists, but you're really interested in EMDR to target certain events in your life, we can do that. I ask for consent and collaboration between me and your current therapist so things don't get messy. We'll focus just on EMDR protocol in our sessions. It's best if you already have your calming skills and you're ready for reprocessing. Otherwise, it might feel a little repetitive from your therapist and seeing me. So we can do that, just work on the reprocessing, and when you're done, you just continue on with your current therapist. Most of my clients that do that will use their current therapist to work on other issues that might be going on, maybe relationship issues, work issues, whatever, and we can focus on the past events and clearing those up, which should also help whatever else you're working on in therapy. There are many different ways we can use EMDR, and it's individualized for each person, so whatever you need. And if you're like, Stacey, oh, that sounds really weird, I don't think I want to do that, I just want to come in and have traditional therapy, we can do that too. It's whatever works best for you. If you have any other questions about EMDR, please feel free to shoot me an email or give me a call. I'd be happy to answer any questions that you have.